All right, good morning, everybody. Thanks for coming. I appreciate you being here. Going to spend a little bit of time this morning talking about some current things in dentistry. It's a great time to be a dentist. People talk about the golden age of dentistry being years ago. It's not. It's now. With the new technologies we have, the new materials we have, instead of just filling holes anymore, now we provide therapy. Topic we're going to talk about is Let's Grow Tooth, and it's all about providing an environment where tissues can heal. Henry Kissinger said this: if you don't know where you're going, any road will take you there. So it's not that I want you to agree with everything I say. It's that you have a plan and understand why you do what you do. A lot of what we talk about today is going to be because we've been there and done that. We've seen things fail. So when I talk about clinical success, it's not because it looked good the day I put it in. It's what it looks like 5, 10 years down the road. We photograph these cases. We've been doing it for 25 years. We're trying to see what gives the best long-term value and benefit to the patient. The numbers tell us that 60% of dentists would not do dentistry again. 60% of you. That's tragic. If we can take a little bit of the information that we talk about today and change your focus, change your energy, change the way you look at dentistry, I think it would be worthwhile me being here. The reason you don't like dentistry, a lot of times though, is because you don't have enough clinical success. We work so hard to make a perfect restoration and to make things look wonderful and feel wonderful, but patients have sensitivity afterwards. Things fail, things break, we run late. All those things add up to be stress for us. Most of the dentists who need to hear this aren't here. They don't come to meetings. They do their CE online. They read magazines and answer questions afterwards. They don't share the experience. They think they're the only people that have the problems that they have, and that's not true. Change it up. Just do something different. Learn something that you've never learned before. Challenge yourself. Place implants. Learn ortho. Start doing endo, whatever it is. Find something that makes it exciting for you, and then become involved. American Dental Association, AGD, American Academy of Cosmetic Dentistry, work towards something. Have something to look forward to. Become advanced in some of these organizations. Learn always. It's all about lifetime learning. It's about sharpening your skills. It's about trying new things. It's about that tooth never hurt until you fixed it. One of the big stressors we have in dentistry is our clinical dentistry is not that good sometimes. You saw patient comes in with tooth number 30. They broke off the mesiobuccal cusp. They have a big MOD amalgam in it. And you tell the patient, hey, I learned in dental school, we need to do a crown on this tooth. You have the patient back in. You take out the amalgam, you do a nice buildup, perfect bonding technique, perfect isolation, a great prep, nice smooth margins, great impression. You send it to the lab. 3 weeks later, you get the crown back. You have the patient in, it fits perfect, no adjustments. Patient goes home, and now they can't chew on the tooth. They can't bite on it. You say the great lie in dentistry. Well, let me adjust the bite. What did you do wrong, if anything? How do we have so much sensitivity? Whatever level of sensitivity you have today, and some of you have a lot, some of you have very little, whatever level of sensitivity you have, we'd like to take it down by half today. We're not going to magically make all of it go away. We're just going to learn some techniques and materials to reduce it significantly. That's the goal for today. And what regenerative means is to provide an environment where tissues can heal. That's what regenerative means. That's the word we want, not necessarily this is a marketing word. Bioactive, to regenerate tissue, provide an environment where tissues can heal. That's the goal of today's lecture. And it all centers around some of the new materials, some of the new techniques that we have. There's a bunch of them on the market, but what we're trying to do is provide an environment where we have therapy instead of just filling holes. Regenerative dentistry, the first thing that we look at is soft tissue. You have to have a plan on what materials you're going to use and how you're going to do this. We're going to have what we call in Missouri a barbecue. We're going to cook some meat. All of you should have a diode laser at this point. All of you. It's the biggest return on investment of all the equipment. When we list equipment on the top 10 list, a diode laser is number 3 on the list for return on investment. We're going to change the tissue so that we can have an environment where we can keep it clean, something that looks better obviously, and something with less bacteria in it. That's the goal. This is just an introductory case. We're just going to talk about this real quick and then we'll go into more detail later. We're going to do some sort of preparation on the teeth, whatever it is you use. We're going to put some sort of matrix in the teeth, and the matrix we use is very important these days. The reason it is because where I live, a lot of patients can't afford crown and bridge, so big composites is what we do all the time. We want to have a matrix that goes mesial, distal, and subgingival all at the same time. This matrix is called the Margin Perfect Matrix, developed by a good friend of mine, Paul Belvedere. This system was originally sold by Ivoclar, and it was called the Contour Matrix. But it comes in a little strip like this, and you peel one off. You take it between your fingers, and you roll it. And we've learned at our hands-on courses that the dentists from Colorado roll things better than in any other state that we teach in. I'm not even sure what that means, but somehow they're good at rolling stuff. It goes subgingival, mesial, and distal at the same time on this tooth here. We're going to use nothing but regenerative type materials. What we mean by that are materials that release ions that allow tissues to heal. In this case, we're going to use a whole product line of gyomers from a company called Shofu. I want you to notice that we have our matrix going subgingival. And always think the smoothest possible surface you can get on a composite is that which is cured against mylar. Every time you polish it after that, you create scratches. It goes subgingival, it stops crevicular leakage, and it allows us to have the smoothest possible surface subgingival. When we place those materials, we're going to do our shaping, our contouring, do the teeth next door. This is all one appointment. When he comes back in, the gum tissue is starting to heal up pretty well. Now we're going to do the lower right quadrant. Again, regenerative dentistry, creating an environment where tissues can heal. When we see this, and this is every day in our practice, patients that don't brush well, they live on Mountain Dew, whatever it is, we get right down to the pulp. Well, years ago, we used to place things like Di-Cal. Sometimes we would put bonding agent directly on there. Nowadays, we put something on there that releases high levels of calcium again because we want to stimulate tooth repair. So when we talk about dentistry today, I want to make sure you understand how important you are. Sometimes the stresses that we feel are because of self-worth, and we don't understand what role we play in a patient's life. I want you to understand how important you are. I got to be a chaperone in Washington, D.C. a couple years ago for the 9th grade field trip. Can you believe they picked me? I was the only guy, the only father. There was 30 kids. I had 14 boys that I was in control of. There was like 16 girls, and they had like 8 women to control them. But I got these 14 boys with me. There's nothing more American than eating a hot dog in front of the Lincoln Memorial. Would you agree? Nothing more American. That kind of thing. Here's the Washington. We went to the White House. We took a tour of the White House with the teacher we were with. She got an invitation to the White House. So we got to go in. We were selected to go into the president's library or whatever that thing is. It was fantastic. Barack wouldn't come out and play with us, though. I don't know why. You know, things change with time. Years ago, we had Steve Jobs, Bob Hope, and Johnny Cash, and they've all passed away at this point. The economy's not good. Now, we have no jobs, no hope, and no cash. In St. Louis, I want you to know how important you are. The question is, please, can you help me figure out why you're getting decay like this? Can you help me figure out why your fillings keep breaking? Can you help me figure out why your teeth are so worn? We look at these cases, and oftentimes we think, wow, must be poor brushing, must be too much Coke, must be too much Mountain Dew, too many Twinkies. You know what? The thing we don't think about enough is drug use. And it's not a political thing, it's not a racial thing, it's not a socioeconomic thing. It could be the person sitting next to you. You have to ask, what is causing the problem? So our job in the past has been to fill holes. We have to think about providing therapy. Therapy using regenerative materials, and more than anything, figuring out the cause of these things. When we see meth cases where we live, almost always the results look like this. So what the guys do is they call in work sick on Friday, they go to the woods, they cook some stuff, they get high for 3 or 4 days. There's no hygiene, there's no diet, they're drinking soda, eating Twinkies, that kind of thing, and they don't care about themselves personally. The question is, can you help me figure out why you're getting this decay? You'll be amazed how often a patient will open up to you. And if you send the staff out of the room and you talk to the patient alone, or vice versa, the staff's talking to the patient alone, you sit down with them and you say, you know, I want to fix your teeth, but I want to make sure that you're in a good state. I want my work to last for a long, long time. Can you please help me figure out why you're getting decay like this? You'll be amazed how often a patient will open up to you. And what I don't want you to do is I don't want you to judge or condemn or critique the person. I want you to just have something planned, and that is give them a card of a therapist, a counselor, somebody in your area that can help them. Because we don't want to fix the teeth and have a good-looking smile if the inner body is still decayed. We want to make sure they're fixed up first. Do your normal dentistry, do your normal regenerative stuff. In this case, we're going to put some bonding agent on there, and a regenerative material called Activa is our build-up material. We're going to shape and polish, do our preparations. We're going to insert our crowns a few weeks later. Normal kind of dentistry, if you will, but the point is this. There's no reason to do dentistry like that if it's going to fail again. please, can you help me figure out why you're having these issues, why things are failing, why things look like this. Don't undervalue your importance. You may save a life, you never know.
An amalgam in there, it's huge, but the cusp is broke off and it's sharp to their tongue. They've had that amalgam in there for 30 years. You have the patient back in there and you say, I know what to do here. I'm going to have you back. I'm going to numb you up. We're going to take that silver filling out and we're going to do a crown. The longest lasting restoration we do in dentistry. And you do the best job you can. A great buildup, perfect bonding. Your impression is spot on. You send it to the lab, get it back a couple weeks later and cement it. Now after you cement it, you meant well, but you cemented it and then the patient comes back the next week and says it's sensitive to cold or I can't bite on it. Has that happened to anybody other than me? Right, what did we do wrong? Did we do anything wrong? Is there something we can do to change that or fix that? That's what we're talking about. Well, it's a long list of things that we can do to kind of mess things up. Well, not really mess things up. I'm not going to go over this whole list with you. That would be boring. I wouldn't do that. But by the time we're done this morning, very short lecture time that I have, we're going to go through some of this stuff. And when we demonstrate, we have 2 different patients to demonstrate this stuff on. The first thing you have to address in these cases is gum tissue, right? So if I were to list a